I remember when Dr. Williams came to me in the room, and it was really, I asked the question, what happens if I did not get an LVAD? And her answer was hospice. And that's when you really take into the account the seriousness of it.
Initially, I had difficulty sleeping. I wasn't able to sleep laying down, and that was what prompted me to go to see the doctor in the first place.
It started off with fibrillation. My heart was going 160 beats a minute. When I talked to the surgeon, he said, well, Ken, if you don't do this, you got 6 to 18 months to go. That's it. So this is your real answer. So then I said, okay, let's do it.
The kit, everything was explained to me initially as to what I would have to do at home by myself without medical assistance. And it wasn't difficult at all. I caught on to it rather quickly.
So the drive line, right, comes out of your abdomen, and it's a little tube, and it's white, and you have a kit. Henry Ford's been nice enough to develop a kit that includes alcohol swabs, gauze, clean, antiseptic things, and every week you replace the dressing. You use the alcohol to clean that drive line. I've never had any issues with my drive line, and the secret, I think, is doing your dressing updates every week.
Of course, we got a little bit of equipment to carry around, but I picked up this vest. It's got both batteries in it, so it keeps it handy, one on either side. Inside the little pocket here is the controller. This is my second controller. This one's a little bit smaller, and the vest wasn't quite built for that, but still it just comfortably goes on there. So, I don't even know it's there at this point. It's just, hey, it's part of me, and it really doesn't prohibit me from doing whatever I wanted.
Once I got the LVAD, I was able to lay down in the bed and sleep normally. I can exercise on a treadmill. I wasn't able to do that before I got the LVAD because of the fact that I would become exhausted at minutes after I started. I have 3 little dogs that I walk every day, approximately maybe 2 miles a day or more. I could not do any of that before I got the LVAD.
The LVAD was very important to me in that I had young boys. They were in high school, and middle school at the time. So I attended their graduations. I got to see that. I got to see my boys off to college. I still play golf. That was one of the things I did before the LVAD, and I still, to this day, I'm in a league. We golf. I'm not great at it, but I golf. There's not a lot of things that I found that I can't do that I want to do.
I've seen probably about 5 more great grandkids. I've seen a couple more weddings of grandkids, and just been able to live and see everybody around me. And
I have 2 daughters and 2 granddaughters. I also have a great-granddaughter, which I'm very happy to be able to see her grow up, or my granddaughter to grow up and get married and have children, which is something that I might not have been able to do if I didn't have the LVAD.
Yes, it is scary. Talk to your family. Think about, what's good for you. And also especially talk to other LVAD patients if you can, and gather all that information you can. But here at Henry Ford, they did a great job with me. They were willing to answer all my questions. So ask your questions, get your input, talk to those patients. In my case, I was sitting there and the doctors told me, an LVAD is right for you. Otherwise, you could end up looking at hospice care. To me, it saved my life.
The people here at Henry Ford I can't say how much they just impressed the dickens out of me. And they helped me along. Without their help, I don't think I would have been able to do it. But once the surgery is not a big thing, and carrying around anything with you, your equipment or whatever, is like a small price to pay for what you've been given.